you have to do. It's not like MD from any place is better than DNB from any place. No, you have to weigh the options.
Because patients will teach you more than books. This is the bottom line. You have to understand that. Hello all, this is Dr. Dheeraj Masapu. Welcome to my channel. Today we have Dr. Neha, who is lead for academics and consultant in anesthesia in my hospital. Welcome, Neha.
Thank you. Hi.
So today we are going to discuss a very important aspect which will help all of you while choosing a seat in counseling in anesthesia or any other branch. So today we are going to tell you whether MD is better or a DNB is better. So why I'm doing this video is, see, if you get an MD in a government medical college, it's a no-brainer, you will take MD. But many of you are getting stuck in a situation where you have MD in a small private medical college, and at the same time you have DNB in a big corporate hospital in metro. So which one to choose? Whether you want to go with MD because it's an MD in a small private medical college, or a DNB. So how do you take the call? So we are going to split this video in different aspects. We are going to tell you how the academics will be in both the places, and also the clinical skills that you're going to get. And once you start your practice, how the differences will be if you join freelancing, or when you join a private medical college, or when you join a medical college itself, how your growth is going to be. We are going to discuss in this particular video. Are you ready? Are you ready, Neha?
Yes, absolutely.
So, Neha, you have done DNB in anesthesia. You worked in a medical college, and later on you shifted to corporate. So, you've seen both the worlds.
Yes.
So, just brief us how a DNB person, what kind of problems or whatever you say you'll have in a medical college scenario. At the same time, I did my MD. I also joined medical college for 3 to 4 months for a very brief period. I will tell you how I was actually treated, or what kind of growth they have shown me in medical college. Let us discuss for medical college scenario.
Thank you, Dr. Dheeraj. Hi guys, I've done my primary DNB in anesthesia from a corporate hospital in Delhi, and I was lucky enough to land that seat because that hospital had impeccable academics, and we did get good hands-on training as well. So I was lucky in that sense. For you guys who are getting these options, so these are the two most important things for DNBs that you have to find out. Speak to the PGs who are already doing DNB in that particular place. Find out about the hands-on training that these guys get, and find out about the academics. See, if it's a MD from a proper big hospital or a government medical college, you are going to get a good academics. That's a given. It's a no-brainer. Academics are going to be good. You will be relieved from OTs, whether it's by SRs or your consultants, because they have a specified academic time every day, every week, something like that. But it need not necessarily be true for all the corporate hospitals who are going for the DNB training. So that's a very important aspect that you need to find out. Having said that, after finishing my primary DNB, I joined one of the country's biggest government hospitals, and it's affiliated to one of the biggest medical colleges as well in Delhi. And it was mainly because I just wanted to get more hands-on training, and quality was always there because I was trained in a corporate setup where we are really hell-bent upon good quality and all those things. So quantity was something that I wanted, and I wanted to fine-tune my technique. So, and this whatever we do as doctors, it's called practice, because through practice we learn, we fine-tune our technique, we fine-tune our studies. So that's what I did there, and in that hospital there was really no discrimination. There were many DNBs like me. But there is one aspect that I found out later on, that as DNB, if your hospital is less than 500 bedded, your DNB, primary DNB especially, is not considered equivalent to an MD. So for that you have to do an extra year of SRship.
But most of the DNB hospitals in India are not more than 500 bedded, very few. So most of you might end up doing a 1 year extra service compared to MDs. That is 1 year is, I don't know whether it is good only for you, I feel. 1 year you'll be trained in a place, but that rule is there. So that is one difference you'll learn. So once you finish 1 year, is there any difference between MD and DNB in the growth in a medical college when they escalate the grades?
Once you have done that extra year of SR-ship, there is really no difference. Yes, if it also depends quite a bit upon who is kind of, running the show there. If it's an oldie or something who are not too well versed with the DNB training training program, they would kind of always be biased towards an MD candidate. So if it's a youngish fellow whose friends have gone into a DNB program or who might have done, a DNB after his or her MD, so they will kind of understand that it's very, countrywide examination is there. There are no discrepancies in the evaluation of the exam papers, and it's a very uniform degree, so to say. The only thing that can be different is the training where the candidates are getting trained. Theory and everything, it's all, same all across the country. So quite a uniform examination, I would say. So after that one extra year, I don't think there is any difference.
So if you finish that 1 year, so on paper at least there is no difference. Yeah. Whatever minor things you're telling, that will be there in any center. Yeah. That depends on the internal politics and all those things will be there. Yeah, that depends on your personality, what relation you have with the head of the department and all that will come. But on paper you don't have any difference. Yeah. So my next question would be, after doing DNB, when you join a corporate hospital, so is there any difference between MDs and DNBs in the way you progress in your career in corporate hospitals?
I don't think so there is any difference, because it always boils down to how good a doctor you are in a corporate setup, how safe a doctor you are. In a corporate, the patient is really, paying quite a good amount of money to get all the care and that extra, tender love and care, TLC is what we call it. And the patient really needs a bang for his or her buck there in a corporate setup. So it always boils down to how good and safe anesthetist you are. So if your training has been good, if your basics are solid, there is absolutely no difference.
Thank you, Neha. So, in corporate hospitals, there is no difference. The bottom line is safe anesthesia is what you have to do there, and high quality anesthesia. Yes. That is what Dr. Neha is telling. So, my next question would be freelancing. So, freelancing, we all know, you hop between the hospitals, you work in multiple hospitals. So, in freelancing, do you find any difference between MDs and DNBs?
Not really, but one point I would like to mention here, if it's a DNB, especially that has been done in a corporate setup, you have already been exposed to world-class machinery, amazing level of, a good tech support and all those things. So in a freelancing setup, we have seen, you also have done freelancing, I have also done freelancing for a brief period of time. We usually don't get good machines, or the good backup is not there. So that you need to be extremely careful about as a DNB. MD students, if you have done it from a government institute, you are kind of used to the bag and mask and old boils machine and all the Kianusi things. So that is one very practical point to note here.
Very important.
Yeah.
So excellent point. So MDs, I don't call it advantage. They have an advantage in freelancing, but what she's trying to tell is they're used to working in a little resource poor situations or suboptimal situations, where DNBs actually work in major corporates, but such kind of things won't happen usually. So then MDs have one extra tick here for freelance. So next question would be, immediately after finishing the MD, I would like to discuss about the confidence levels and independent working conditions. So which one what do you think is better, MD or DNB?
I think MDs score a point here, because I have also seen when I worked in the government hospital, there the MD candidates usually are given independent OTs second year onwards, and by final year they are almost ready to run the list on their own. It's like the seniors, they are there, but that's more like remote supervision, right? But in a DNB setup, even as a third year, there was a consultant always there with me, and then it also depends what kind of an impression you've made on your seniors. So if they feel you are safe enough, they will give you that free hand, but there will always be an element of, okay, we'll just kind of hang around in the OT in the corner for a bit, because it's a DNB in a corporate hospital. At the end of the day, again, the patient I'm not trying to say here that you pay good money and then only you are safe. I practice safe anesthesia in a government setup also. My anesthesia practice has been uniform throughout, whether it's a corporate or a government setup, but it's just the way things are. So you have to understand how these things go.
Super. So, got it. So, bottom line is that MDs in DNB, you are being supervised till you finish the process, because there is a reason for that. In corporate, every OT will have a consultant.
Right.
So, and you will be posted under a consultant. But in MD, usually what happens is there will be assistant professor, associate professor. For 2-3 OTs, there will be one supervising assistant or associate. So you might end up working alone in most of the times from second year onwards.
That gives you a certain level of confidence.
Yeah.
So that working alone part gives you a certain level of confidence. You can't really contest that.
Yeah. So that's superb. Since Neha is the lead for academics, about academics, what do you feel? Is there any difference between corporate, or how, before choosing, how do they actually know whether academics are happening in that particular corporate? And MDs, I can tell that there is a minimum guarantee in whatever private hospital, private medical college, or whatever this thing, some program will be there. But in DNBs, what happens in some centers, there is not at all any kind of a program.
Yeah.
So some comments on that unit.
See, here we have to do a bit of a homework. You have to find out. Now, let me give you a scenario here. Suppose it's an MD seat in a godforsaken corner of the country, which has 2 OTs, all of 2 OTs, and just probably 2-3 assistant professors or professors. And you really can't expect that place to be good for hands-on training or for academics. All of 2 OTs, hardly probably 2 or 3 cases a day. What kind of training are you going to get? It might be a simply paid seat or something. So MD from such a place is quite detrimental, I would say. It might not be of much help for your future. Now the other scenario is you are doing DNB from a big or an average corporate hospital that has 6-7 OTs and some 5-6 consultants, and then you get a bit of good hands-on. In these places you have to do your homework and you have to find out what kind of academic program are they running. Are they having dedicated classes? How many classes in a week? And what exactly is the academic schedule going on in these DNB hospitals? The seniors who are already doing the DNB there, they would give a good clue. I think that word of mouth is always there. So I believe that you have to do. It's not like MD from any place is better than DNB from any place. No, you have to weigh the options.
So bottom line is, rather than working in a hospital where no cases are being done, better to work in a hospital where cases are being done, and you start reading your books. And even ISA is conducting a lot of programs nowadays. Lot of YouTube, so many videos are there, and even in Zoom, so many meetings happen. You attend those meetings and try to cover up your theory knowledge. But doing cases is more important. That's what Neha is telling, because patients will teach you more than books. This is the bottom line. You have to understand that. My professor used to tell me all the multiple times. So this is about so between MD and DNB, what are the differences we have told you in the training and in different setups when you practice? What kind of differences? Since we both are anesthesiologists, our discussion would benefit maybe anesthesiologists more than surgeons, because when we are discussing about surgical field, the discussion will be totally different. Because for example, a surgeon needs to operate. Reading and Zoom and webinars all become secondary to them. So if you're planning to choose a surgical branch, it is always advisable to do an MS General Surgery in a government hospital. What do you say? Some surgeons also, if they're seeing, then
Again, I think we have to do a bit of a homework there. But yes, a corporate hospital giving hands-on to a newbie who is just, entering the field of surgery, it's really difficult. At least in a government setup, by the end of your third year, you'll be able to do independent hernias, independent appendix, all those things. In a corporate setup, that's really difficult, yeah, anesthesia is different, and we are not downgrading any branch here, but yeah, it is what it is. Yeah.
So that's it, guys. I hope you got some very valuable information, and this video will help many guys. Thank you, Neha. So any final concluding points you want to tell to the audience?
DNB versus MD, this is an age-old contest, a war. I'm happy. Yeah, pass percentage, yes. See, MD, it's like entering is difficult because you have to qualify the entrances and all those things. For that matter, now, so when you're doing the MD, you are taking the examination in your own hospital. The cases that are kept, long case, short case, whatever there is, your senior or your juniors who are in that examination committee, they will tell you. So you are in a familiar ground. Whereas DNB examination, at least before COVID, it used to be in a different city. Theory will be in your own city, and practical is in a different city. I wrote my theory in Delhi, and I went for my practicals in Hyderabad. A completely new city, a completely new setup. I didn't know anyone, didn't know the language. So yes, that bit of a stress is there. But at the end of the day, since I came out with flying colors, so that extra bit of confidence also I have that if I can do it in some other state, I can do it anywhere. So that is there. And frankly speaking, you have to know your stuff well, whether you are an MD, whether you are a DNB, you have to know your stuff well, and you have to be a safe anesthetist. I'll speak about anesthesia because I am an anesthesiologist. You have to be a safe doctor at the end of the day. So a surgeon can only be safe when he or she has operated that many cases and fine-tuned his or her technique. Same applies to us as well, and that is what matters at the end of the day.
Thank you guys for following the video till this point, and now you have to decide which one to choose, MD or DNB. Hope you take a very good decision. If you have any doubts, you can comment in the comment section and subscribe to the channel, and I will always answer all the comments that you can check out in my previous videos also. And you can also connect to me in my Instagram, Masapu Dheeraj. If you want to put a personal message, many people are actually asking how to actually contact me. You can put a personal message in Instagram, Masapu Dheeraj is the ID, and you can put a message there. I'll reply to every comment of yours. Okay, thank you very much. Roger that.